Welcome to the e-learning series, Improving Cancer Outcomes for Aboriginal and Torres Strait Islander People. This first module will give you an overview of cancer and Aboriginal and Torres Strait Islander peoples and explore the factors that impact on the current health inequalities affecting First Nations Australians. This module was developed by the Menzies School of Health Research in collaboration with the Psycho-oncology Co-operative Research Group. At the end of this module, you will have a good understanding of Aboriginal and Torres Strait Islander people's approach to health and the factors that contribute to health inequalities, national cancer trends and indicators, factors that contribute to poorer cancer outcomes for Aboriginal and Torres Strait Islander people, and how we can enable optimal cancer care and quality research with Aboriginal and Torres Strait Islander people. We acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, waters and culture. We pay our respects to their elders past, present and emerging. Aboriginal and Torres Strait Islander people are the Indigenous people of Australia. They are not one group, but comprise hundreds of groups that have their own distinct set of languages, histories and cultural traditions. Just over 3% of the total Australian population are Indigenous Australians. Aboriginal and Torres Strait Islander people view health in a holistic context, and this is reflected in the holistic definition of health contained within the National Aboriginal Health Strategy. Well-being for Aboriginal and Torres Strait Islander people incorporates broader issues of social justice, equity and rights. These concepts also acknowledge the connectedness between these factors, whilst also recognising the impact that historical trauma, racism and ongoing social marginalisation has on health.
My family's from Bungunya, Torwood, Toomala Mission, sort of around the Gundawindi area. So that's where most of the family are from out bush. So the diagnosis, I'll go back to when I was in Katherine in Northern Territory, and I had a bit of problem with me left ear. So I went and seen the doctors to say that it might have been something wrong stuck in my ear. So, but unfortunately that went on for about probably about a year or 6 months or something like that before other things started to happen. So it was kind of a long process before the actual being diagnosed. And I still never got diagnosed where I was living in the Northern Territory. So I flew over to Brisbane, and within a week of flying from Alice Springs to Brisbane, they diagnosed me with stage 4 head and neck cancer. So it was pretty bad news, to thinking you just got a earache or bad sinus problems, to finding out that you've actually got stage 4 cancer. So it took a while to be actually properly diagnosed with the cancer. And the other thing was that diagnosis was just terrible for me. I doubt that if they would have listened to me when I had that funny thing going on in my ear, then I reckon I wouldn't even have stage 4 cancer.
In 2008, the Australian government made a formal commitment to address Indigenous disadvantage in Australia, known as Closing the Gap. But what is the gap? The gap refers to the vast health and life expectation inequality between Indigenous and non-Indigenous Australians. The gap in health between Aboriginal and Torres Strait Islander people and other Australians is evident in factors such as a shorter life expectancy, more than twice the rate of infant mortality and double the rate of non-fatal burden of disease. This disadvantage has immediate social, economic and cultural determinants, as well as deeper underlying causes. Let's look at some of the factors that contribute to health inequalities for Aboriginal and Torres Strait Islander people. These factors are known as determinants of health. Aboriginal and Torres Strait Islander peoples have higher rates of smoking and risky alcohol consumption, exercise less, are more likely to be overweight or obese, and have a greater risk of high blood pressure than non-Indigenous Australians. These risk factors are common contributors to many preventable chronic conditions, including cancer. Aboriginal and Torres Strait Islander people are more likely than other Australians to report greater difficulty in accessing high quality, timely and affordable health services. Providing safe, welcoming and inclusive services that meet the needs of Aboriginal and Torres Strait Islander peoples is crucial to overcoming negative experiences of institutions. Social determinants are estimated to be responsible for more than 1/3 of the health gap between Indigenous and non-Indigenous Australians, and health risk factors such as smoking and obesity are estimated to account for about 1/5 of the health gap. Social determinants of health are a complex set of underlying factors that contribute to our health outcomes. These include a person's income, educational attainment, employment status, and levels of social support. For Aboriginal and Torres Strait Islander people, factors such as connections to culture, family and community, and to country all play a large part in influencing their health and well-being. It is also important to view health in the context of historical determinants and the ongoing impact that colonisation, trauma, racism, and social marginalisation has on Aboriginal and Torres Strait Islander people. It has become increasingly clear that cancer is an important health priority for Indigenous Australians, both in absolute terms as a leading cause of mortality and in relative terms based on disparities in the cancer burden between Indigenous and non-Indigenous Australians. We will now have a closer look at the inequality in cancer outcomes experienced by Aboriginal and Torres Strait Islander people compared to other Australians. Cancer remains a pressing healthcare challenge in Australia, and this is particularly so for Indigenous Australians. Cancer Australia has developed a national set of cancer control indicators across the continuum of cancer care to monitor and report on various cancer-related measures and outcomes, and these are outlined on this slide. The cancer continuum is complex, and we will now explore this journey for Aboriginal and Torres Strait Islander people and map this against the cancer control indicators. Prevention is an effective long-term strategy for reducing the burden of cancer, and many of the cancers diagnosed in Aboriginal and Torres Strait Islander people are largely preventable. As mentioned on an earlier slide, Aboriginal and Torres Strait Islander people have higher levels of cancer risk factors, and these and some other cancer risk factors are outlined on this slide. Effective population screening programs can help reduce the incidence of late-stage cancers. However, Aboriginal and Torres Strait Islander peoples are less likely than other Australians to participate in all three of the national cancer screening programs. Some of the reasons for lower participation include lack of access to health services, particularly for those living in regional and remote communities, lack of culturally relevant educational resources, distrust of mainstream healthcare providers and government services, lack of Indigenous healthcare providers. We will talk about cancer incidence later in this module. This phase also encompasses stage at diagnosis, and we know from the data that has been routinely collected that Aboriginal and Torres Strait Islander people are more likely than other Australians to be diagnosed at a more advanced cancer stage. This is particularly so for some cancer groups. For example, a high proportion of colorectal cancers and lung cancers are diagnosed for Aboriginal and Torres Strait Islander peoples at a more advanced stage than non-Indigenous Australians. While there are issues with routinely collected data on treatment and data gaps in the collection of Aboriginal and Torres Strait Islander status, information from research projects has shown us that Aboriginal and Torres Strait Islander people are less likely to receive care in line with clinical practice guidelines, more likely to experience delays in receiving treatment, and more likely to report reduced uptake and/or completion of treatment. Psychosocial care should be considered an integral part of cancer care for patients and their families at all stages of the illness trajectory. Aspects of psychosocial care include the patient experience, including the emotional, psychological, and practical day-to-day demands that impacts on the patients and their carers and families' well-being. Research investigating the unmet support needs of Aboriginal and Torres Strait Islander cancer patients has reported that 71% had at least one unmet need, with most needs being in the psychological and practical domains. Recent evidence also indicates that 1 in 3 Aboriginal and Torres Strait Islander cancer patients report clinically significant distress following a cancer diagnosis. In recognition of the importance of clinical trials, there are indicators about clinical trials participation in the NCCI. However, we don't have a clear picture about Aboriginal and Torres Strait Islander people's participation in clinical trials and who may be missing out. Recent evidence indicates there may be barriers to accessing clinical trials for Aboriginal and Torres Strait Islander people. These are related to where they live, types of cancer, general health status, and less transparent reasons such as investigator judgment. Greater scrutiny is needed to improve transparency and overcome structural barriers to promote equitable access to trials for Indigenous Australians. We will now go into more detail about incidence, mortality, and survival data for Aboriginal and Torres Strait Islander people. The age standardised incident rate for all cancers combined is higher for Aboriginal and Torres Strait Islander people compared to other Australians. Lung cancer is the most common cancer diagnosed in Aboriginal and Torres Strait Islander people between 2010 and 2014, followed by breast cancer in females and colorectal cancer. The overall cancer mortality rate for Indigenous Australians is significantly higher than non-Indigenous Australians, and it has been increasing since 1998. The leading cause of cancer deaths among Indigenous Australians is lung cancer, followed by colorectal cancer, head and neck cancers, and liver cancers. The reasons for these higher mortality rates among Aboriginal and Torres Strait Islander peoples include a greater likelihood of being diagnosed with cancers where the prospect of successful treatment and survival is poorer, being diagnosed at a more advanced stage, and being less likely to receive cancer treatment concordant with clinical guidelines. Given this mortality gap, it is not surprising that the overall cancer survival rate is lower for Indigenous Australians compared to other Australians. In the figure you can see, Indigenous Australians diagnosed with cancer had a 50% chance, on average, of surviving 5 years, compared to the 65% survival rate experienced by non-Indigenous Australians.
Quite hard to keep track of who's actually in charge of you. You might have one main doctor, but there's a team of 10 people working underneath, so you're pretty much lost with actually where you're getting your details from. So I think that's like the missing link in that section. The treatment that I had was a 6 to 7 week intense treatment. So I had 35 treatments of radiation and 3 rounds of chemo. So I probably have to travel about 45 minutes every day. So I was actually driving myself to treatment within the first 2 weeks. Then I actually had to live in the city at a aunt's place because with all that treatment going on, it was just too much for myself to travel an hour away from the hospital every time. So yeah.
There is a broad range of factors that contribute to the poorer cancer outcomes for Aboriginal and Torres Strait Islander people. So far in this module, we have looked at the role that social and cultural determinants play in influencing health outcomes. We have also briefly touched on some risk factors. We will now look at some of the more complex, interrelated factors that can also impact cancer outcomes for Aboriginal and Torres Strait Islander people. These include factors that are related to the individual and to health services and the broader health system, as well as political, social, and cultural factors. In the outer circle, and taking a strengths-based approach, we need to acknowledge the cultural diversity of Aboriginal and Torres Strait Islander people, whilst also acknowledging the political and socio-cultural factors that continue to impact on Aboriginal and Torres Strait Islander people today as a result of the enduring legacy of colonisation and the ongoing marginalisation and disempowerment Indigenous people face due to the political environments in which they live. Some key concepts that are listed in the inner circles that are fundamental to Aboriginal and Torres Strait Islander health and improving cancer outcomes include providing a holistic approach to health and well-being and acknowledging the diversity of Indigenous Australians and understanding the social and cultural determinants of health. We know through research and talking with Aboriginal and Torres Strait Islander people and communities that Aboriginal and Torres Strait Islander people's beliefs and perceptions around cancer and their experiences with the health system can influence whether they engage with and adhere to cancer screening and treatment. This is an area you can change through the conversations you have with your patients and their carers. Assisting Indigenous patients and their family with their support needs and practical issues such as travel, accommodation, and the financial challenges they often face is important to keeping them engaged in the system. For many Aboriginal and Torres Strait Islander people, the Aboriginal health workers and liaison officers are the cornerstone of Aboriginal and Torres Strait Islander health. They are the cultural brokers who provide a vital link to the community across the cancer care continuum and are in an ideal position to make a real difference to health outcomes for Aboriginal and Torres Strait Islander peoples. However, improving cancer outcomes for Aboriginal and Torres Strait Islander peoples is the responsibility of the entire health workforce and requires a high level of commitment and capacity to meet the diverse needs of Aboriginal and Torres Strait Islander people.
I had a friend that helped me through with that process, and a couple of family members, but when you're living so far away and your family lives so far away, it's a bit hard. You sort of just got to use the resources that are within the hospital. I found most of my help was from the liaison officers at the hospital. It'd be good if, with those health professionals, to actually have another Aboriginal liaison officer with you at that time. If it's some really serious cancer issues, then it might be best to have that in. It's just to make sure that the Aboriginal person is feeling comfortable, and sometimes there's a language barrier. So I think the main one would be to have the Aboriginal liaison officer or someone from a medical centre that can sit with that person, or someone that's on call that can help them through that process. So the health professions can understand what's going on as well as the patient. And I think once you have those two, then things will just move forward. People feel frightened or they feel that they don't want to go and do that annual health check, but it's very important to have the health check. And if you are diagnosed with cancer, it's best to always get a second opinion and ask for someone to help you through that process, because I think no one should ever go through the cancer treatments and that through by themselves, or if they're too far away from family. And try and ask for as many resources that you can that'll help you through that cancer journey.
Now we will take a brief look at some of the ways we can improve the experience for Aboriginal and Torres Strait Islander people diagnosed with cancer and their families. These and other enablers will be discussed in more detail later in the e-learning series. As we talked about at the beginning of this module, culture plays a large role in Aboriginal and Torres Strait Islander health and well-being. Cultural safety includes how healthcare services are provided, Indigenous patients' experience of healthcare, and Indigenous people's access to healthcare. Cultural respect is achieved when the health system is a safe environment for Indigenous Australians and where cultural differences are respected. Indigenous Australians experience poorer overall health than non-Indigenous Australians, and as we have mentioned earlier, they also experience poorer cancer outcomes, and they face many challenges in accessing health services. Healthcare services are more effective when providers have an awareness and interest in Indigenous culture and when their cultural identity is respected. Aspects of cultural safety include good communication, respectful treatment, empowerment in decision-making, and the inclusion of family members. There are many aspects to effective communication with Aboriginal and Torres Strait Islander people, and we will go into much more detail in a dedicated module later in our e-learning series. In brief, people's cultural beliefs, values, and worldviews influence thinking, behaviours, and interactions with others. It is important to remember that your own beliefs, values, worldviews, and experiences may be different to that of Aboriginal and Torres Strait Islander patients. Some Aboriginal and Torres Strait Islander people do not speak English as their first language. Some general tips to overcome language barriers include: avoid using complex words and jargon. Explain why you need to ask any questions. Use diagrams, models, and images to explain concepts, instructions, and terms. Due to family kinship structures and relationships, decision-making usually involves input by other family members. Check with the person if their decisions require consultation with family. Allow time for information to be clearly understood. Time is perceived differently in Aboriginal and Torres Strait Islander cultures, as more value is placed on family responsibilities and community relationships. So take the time to explain and don't rush even though you may have limited time. Extended periods of silence during conversations for some Aboriginal and Torres Strait Islander people are considered the norm. Silent pauses are used to listen, show respect, or consensus. The positive use of silence should not be misinterpreted as lack of understanding, agreement, or urgent concerns. Observe both the silence and body language to gauge when it is appropriate to start speaking. Be respectful and provide the person with adequate time. The Aboriginal health worker or Indigenous liaison officer may be able to assist with cultural knowledge and interpreting information. Evidence-based resources and tools are critical in providing effective cancer care. Some useful examples are highlighted here for you. Here is a list of references we used for this presentation. We encourage you to look at these in more detail to gain a greater understanding of the content in this presentation and improving cancer outcomes for Aboriginal and Torres Strait Islander people. Thank you for taking part in the e-learning series, Improving Cancer Outcomes for Aboriginal and Torres Strait Islander People. We hope you now have a better understanding of factors that contribute to poorer cancer outcomes and how we can enable optimal cancer care and quality research with Aboriginal and Torres Strait Islander people. Keep a lookout for the further modules developed in this series that go into more detail on how to improve cancer outcomes for Aboriginal and Torres Strait Islander people.